Rahim, respected Vice Principal Sir, Director Sir, Chairperson of the seminar, my respected teacher, colleague and junior doctor, Assalamu alaikum. I am Dr. Taslima Sultana Dima, lecturer, Department of Pharmacology and Therapeutics. Welcome you all in today's scientific seminar. Our topic is prescription pattern of oral anti-diabetic agents among type 2 diabetic patient in outpatient department of a tertiary care hospital in Bangladesh. Today our chairperson, Dr. Shaminara Begum, Professor and Head Department of Pharmacology, and the resource person, Dr. Muhammad Aminul Islam, Professor and Head Department of Medicine. Our speaker, Sultana Razia, Assistant Professor, Department of Pharmacology. Now, I would like to request the chairperson to come to the dais and conduct the rest of the session, please.
Assalamu alaikum. I would like to welcome Dr. Sultana Razia, Assistant Professor Pharmacology, to present her topics.
Thank you, madam. Assalamu alaikum to all my teachers, respected principal sir, respected director sir, vice principal sir, and all my teachers. Now, with the permission of chair, I would like to present my presentation. My today's topic is prescription pattern of oral anti-diabetic agents among type 2 diabetic patients in outpatient department of a tertiary care hospital in Bangladesh. Introduction. Diabetes mellitus is a chronic metabolic disease which is characterized by persistent hyperglycemia due to absolute or relative deficiency of insulin. Type 2 diabetes mellitus occurs due to insulin resistance and relative insulin deficiency and engulfing around 90% of all diabetes mellitus cases worldwide. This increasing trend of type 2 diabetes putting tremendous burden on medical, economic and social infrastructure. Type 2 diabetes mellitus more common in older adults, but a significant increase in the prevalence of obesity among children has led to more cases of diabetes in younger people. Because of the progressive nature of the disease, an evolving treatment strategy is necessary to control blood glucose level. American Diabetic Association recommended a target of hemoglobin A1C less than 6.5% for glucose control in clinical practice. If used properly, orally ingested hypoglycemic drugs are highly effective in controlling type 2 diabetes mellitus. The pharmacological armamentarium to treat hyperglycemia in type 2 diabetes mellitus has changed substantially over the past years with the development of new therapeutic agents. These changing treatment recommendations advocating for an intense glycemic control in early stage of the disease makes drug choice increasingly challenging, and it has driven substantial change in current prescription practices with wide variations between countries depending on each therapeutic class. Oral anti-hyperglycemic trends keep on changing, and thus the drug prescription pattern may prove to be powerful exploratory tool for healthcare providers. Monitoring of oral drug prescription pattern considered to be one of the most effective methods to assess and evaluate the prescribing attitude of physicians. Finding of the study will give some idea on prescribing pattern in Bangladesh and can help the prescribers to do necessary modifications of the prescription to achieve rational and cost-effective medical care. Now the objective of the study, general objective is to observe the pattern of using oral anti-diabetic drugs to control blood glucose level among type 2 diabetic patients attending outpatient department of endocrinology in a tertiary level hospital in Bangladesh. The specific objectives are to find out most preferred drug at the initiation of treatment, to observe commonly prescribed oral anti-diabetic drugs among type 2 diabetic patients, to find out the frequency of using drugs as monotherapy or combination therapy, to determine number of drugs prescribed per encounter. It is a cross-sectional descriptive type of observational study, and type 2 diabetic patients taking oral anti-diabetic agents at attending outpatient department of endocrinology in Mymensingh Medical College Hospital or the study population. This study was conducted in the Department of Pharmacology and Therapeutics in collaboration with Department of Endocrinology in Mymensingh Medical College, Mymensingh. And total study period was 1 year, extending from July 2021 to June 2022. And total 172 sample was taken, and sample was selected using purposive sampling. Now the inclusion criteria. Diagnosed type 2 diabetes mellitus patients, patient using oral anti-diabetic drugs, patients having diabetes not more than 5 years, willing to enroll in the study with informed consent. Exclusion criteria are patients not willing to give consent, type 1 diabetes mellitus patients, hospitalized type 2 diabetic patients, patients taking insulin as anti-diabetic agents, patients taking oral drugs and insulin at the same time. Now the study variables, so some socio-demographic variables are age, gender, socio-economic condition and occupation, and clinical variables are comorbidities like hypertension, obesity or overweight, monotherapy and combination therapy, family history of diabetes mellitus. A set structured questionnaire was used for data collection, and data were collected by interviewing the patients and reviewing the patient's prescription. That collected data were checked and edited first and processed with the help of software SPSS version 22 and analyzed. Now the results. This table shows the socio-demographic characteristics of the study participants. Here, here we can Here we, in case of age distribution of the participants, we can see that majority, that is 29.07% patients are in 31 to 40 years age group, and also 26.16% patients in 41 to 50 years age group, and 24.42% patients are in 51 to 60 years age group. And in case of gender and occupation, maximum patients are women and housewives, and other occupation includes service holder, businessmen, and farmers. This table shows the duration of type 2 diabetes mellitus in the study population, and we can see here that majority, that is 30.81% patients had a history of diabetes for 4 to 5 years. And the family history of diabetes mellitus of the study population shows that 39.55% patients having positive family history of diabetes mellitus. This pie chart shows the comorbidities of the study population, and out of 172 patients, 63.95%, but that is majority patients had different comorbid conditions along with type 2 diabetes. This table showing the prevalence of comorbidities in the type 2 diabetes mellitus patients, and shows that majority of the type 2 diabetes patients have hypertension as associated comorbid conditions, and other comorbidities includes dyslipidemia, hypothyroidism, ischemic heart disease, diabetic nephropathy. This pie chart showing the body mass index of the study populations, showing that although majority of the patients have normal BMI, but 43.60% patients are overweight, and 1.16% patients are obese. This pie chart showing the distribution of drugs at the initiation of treatment, and we can see here that majority of the patients, that is 55.23% of the patients are initially treated with biguanides, and 19.7% are with sulfonylureas, and 11.05% are with dipeptidyl peptidase 4 inhibitors, and 13.95% could not mention the name of the initial drugs. Now the distribution of oral anti-diabetic agents and monotherapy and combination therapy, showing that maximum patient, that is 83.14%, received combination therapy. Here the distribution of different classes of oral anti-diabetic drugs, showing that majority of the patient, that is 44.77% patients are treated with sulfonylurea, biguanides and DPP-4 inhibitors. And then the 18.05% patients are treated with sulfonylurea and biguanide combination, and 11.63% patients were given only biguaners, and other significant combinations were given biguaners and DPP-4 inhibitors, biguaners and SGLT2 inhibitors, and sulfonylurea SGLT2 inhibitors. Some patients are given sulfonylurea, biguaners, SGLT2 inhibitors, and some patients are also given sulfonylurea, biguaners, DPP-4 inhibitors, and SGLT2 inhibitors. Now, the prescribing frequency of different oral anti-diabetic agents. Here, total number of anti-diabetic drugs were 406 during the study period, and metformin is the most commonly prescribed anti-diabetic drug. And gliclazide used in 120 out of 406, gliclazide used in 126 cases, metformin in 158 cases, linagliptin used in 104 cases, and empagliflozin, SGLT2 inhibitors used in 18 cases. Average number of anti-diabetic drug per prescription was 2.36. Now, the prescribing pattern of oral antidiabetic drugs according to WHO prescription indicators. Here, total for 602 drugs were prescribed during the study period, and all of the drugs are prescribed by brand name. Average number of drugs prescribed per prescription was 3.6, and 62.13% were prescribed from National Essential Drug List. Now, the discussion. The rationality of the prescription can be assessed and evaluated using a prescription-based study, one of the methods available for such purpose. The objective of the current study was evaluating the prescription pattern of oral antidiabetic drugs for treatment of type 2 diabetes mellitus patients in a tertiary care hospital. This study was conducted in the outpatient department of endocrinology in Mymensingh Medical College Hospital. In this study, analysis revealed that majority of the patients were in 31 to 40 years age group, which shows some similarity with the study conducted by M.S. Alam et al., where large number of patients were in the age group of 41 to 50 years. But Bhavna et al. Found in a study that 51 to 60 years age groups are more prone to develop type 2 diabetes mellitus. Development of type 2 diabetes mellitus at early age may be due to the fact that nowadays type 2 diabetes is occurring not in the older adults but also in young people, young age, due to development of obesity. In this study, we found that type 2 diabetes mellitus is more prominent in women than men, which is confirmed by demographic characteristics showing women to suffer more from type 2 diabetes than men, which was similar to the study conducted by Balbi V et al., Joglekar NP and Joglekar Pierre 1 et al. This may be assigned to the fact that women are more obese than men. The other reasons might be due to lack of physical activity, lifestyle change, dietary habit, stress, and pregnancy. Considering occupation, we found that majority of the patients are housewives, and which shows some similarity to the study conducted by Patel v. et al., where majority of the participants were housewives. This represents that most of the female patients are housewives and don't do much physical activity, which leads to obesity and ultimately diabetes. In this study, 39.55% patients had positive family history of diabetes mellitus. Nearly similar results are found in a study conducted by Sharma D. et al., where 40% of patients had a positive family history of diabetes mellitus. Positive family history of diabetes mellitus is an important risk factor in the development of type 2 diabetes mellitus. In present study, 43.60% patients were overweight, which shows some similarity with the study conducted by Tamil Selvan et al. Overweight persons are more prone to develop type 2 diabetes. Overweight and obesity is an important risk factor for development of type 2 diabetes mellitus and considered to be the link between insulin resistance and metabolic abnormalities. Patients having diabetes not more than 5 years were taken for this study and found that majority of the patients had diabetes for 4 to 5 years. Patients with long duration of diabetes has an important role in developing diabetic complications. Patients who had a history of long duration of diabetes more prone to develop diabetic complications than who had a history of short duration of diabetes. This study revealed that 63.95% patients have different comorbidity. Most prevalent condition is hypertension followed by dyslipidemia hypothyroidism, which is supported by the study conducted by G. Sultana et al., Tamil Selvan et al. Combination of hypertension and diabetes mellitus is clinically important because it magnifies the risk of diabetic complication. In this study, bigonides, metformin was the most commonly used oral antidiabetic drugs as the initial treatment therapy for type 2 diabetes patient. The results are in accordance with the ADA 2021 standard treatment guideline, which recommend metformin to be used as initial therapy in most of the patients in view of long-standing evidence base for efficacy and safety. Also because it is inexpensive and may reduce the risk of cardiovascular events. This study revealed that majority of the patients were prescribed combination therapy, which was similar to the study conducted by G. Sultana et al., Chu et al. In combination therapy, sulfonylureas, biguanide, and DPP-4 inhibitors was mostly prescribed combination. A study conducted by Sharma et al. Showed that combination of metformin, glimepiride, and DPP-4 inhibitors was commonly prescribed triple therapy, which shows some similarity to the present study. In this study, second most commonly used combination was sulfonylurea and biguanide combination used in 18.02% patients. Multiple combination for the treatment of type 2 diabetes mellitus may be due to the progressive nature of the disease and association of different comorbid conditions. This study revealed that metformin was the most commonly prescribed anti-diabetic agent, that is 38.92%, followed by gliclazide and DPP-4 inhibitors. Similar results were found in the study conducted by Shuddha Sharma et al., where metformin was mostly prescribed oral antidiabetic drug used in the treatment of type 2 diabetes. The high metformin prescription rate probably due to increased awareness and knowledge of the physician about metformin, and also metformin is the first-line drug for type 2 diabetes according to ADA and other guidelines. Metformin also has ability to prevent micro and macrovascular complications and also promote weight loss. Other reason for high rate may be due to its low cost, easy availability, and also metformin is a peripheral sensitizer of insulin, has beneficial effect of insulin resistance, an important factor in the pathogenesis of type 2 diabetes mellitus. Among sulfonylurea, gliclazide prescribed in 31.03% cases. High prescription rate may be due to it is a powerful oral anti-diabetic drug and it produces less hypoglycemia among all sulfonylurea, and it has also antiplatelet effect. Linagliptin is the most commonly prescribed DPP-4 inhibitors in this study regarding the anti-diabetic medication. DPP-4 inhibitor is one of the most widely used drugs, either monotherapy and combination therapy. DPP-4 inhibitors have several advantages such as appropriate effect on blood glucose lowering, a neutral effect on body weight, and relatively less hypoglycemia. There are advantages for the patients who are close to their target hemoglobin A1C but experience elevated glucose level after meal. In this study, empagliflozin, a sodium glucose transporter 2 inhibitors were prescribed in 4.40% cases. SGLT2 inhibitors are the newer drug that inhibit reabsorption of glucose in kidney and lower blood glucose level and provide cardiovascular benefit in type 2 diabetes mellitus patients. Empagliflozin also causes weight loss and acts as insulin independent manner. For this advantageous effect, nowadays prescription of this drug for type 2 diabetes patient increased. This study shows that average number of drugs per prescription was 3.5. This shows a high rate of average number of drugs per prescription compared to the study conducted by G. Sultana et al., but lower to the study conducted by Shuddha Sharma et al. Average number of anti-diabetic drug per prescription was 2.36. This differed from the study conducted by Sridevi S. and Ganesh M.A., where average number of oral hypoglycemic agents were 1.8. Possible reason of high number of drug per prescription may be due to association of different comorbid conditions, which require more medications for their additional illness, and also due to complex pathological process in the development of type 2 diabetes mellitus. Considering drug nomenclature, 100% drugs are prescribed using trade name. Being tertiary level teaching hospital, use of generic name should be encouraged. Cost effectiveness of drug can be minimized by prescribing drugs in generic name rather than trade names. As this study was a cross-sectional study, no follow-up was done and patients' adherence to oral antidiabetic therapy was not noted. The study would have been more comprehensive if pharmacoeconomic analysis were also done. Now the conclusion. Type 2 diabetes mellitus is a chronic disease, and in the management of type 2 diabetes mellitus, oral antidiabetic drug plays an important role. If used properly, oral antidiabetic drugs are highly effective in controlling type 2 diabetes mellitus. There are some limitations of the study, as sample size are small due to short period of times. In this study, all the prescriptions are collected from a single hospital, and it may not be a representative of prescribing pattern across the country. Here are some photographs of prescription that was taken. Thank you for your patient sharing.